Ligamentum arteriosus. What is ligamentum arteriosus? Remnants of what? What is the function of ductus arteriosus? Huh? See, during intrauterine life, blood does not go to your lung, because if it goes to your lung, you will drown. So your heart receives blood through the umbilical umbilical vein, and gets into superior and inferior vena cava and enters into your right atrium. So the blood passes from to your right atrium. 75% of this blood goes through the foramen ovale into your left atrium. 25% passes here. And that will be taken to the pulmonary trunk. Now let's wait here. Now this 75% of blood will come to your left ventricle. So. So, that 75% will go through aorta into the rest of the body. That 25% will go through the pulmonary trunk. Now, if it goes to your lung will fill up with blood. You drown. So what happens? That 25%, 15% of that 25% will go through this ductus arteriosus into your aorta. 5% will go to this lung, and 5% to this lung. These 5% supplying blood to the parenchyma, means to the tissue of the lung, for the tissue of lung to survive. And the rest are getting through this ductus arteriosus into your aorta. And that's called ductus arteriosus. Now, when first time you breathe in, when you first breathe after birth, the pressure changes, the lung expands, sucks the blood in. So here the pressure was high and the blood was moving to the left. Now the pressure on the left side increases and pushes this septum inwards, and therefore closes this. And the remnants is known as fossa ovale. And at the same time, fibrosis of this is called ligamentum arteriosus. What keeps this ductus arteriosus open during intrauterine life? What keeps this open? Prostaglandin.
Oh, goodness.
Prostaglandin keeps this open. That's why when you are pregnant, they tell you not to take pain medicine. Pain medicine decreases prostaglandin level, and when the prostaglandin level decreases, this fuses. So if it stays open after birth, what do you do?
Give the child.
Huh? You give pain medication. If it doesn't close, then you will do it by surgery. So that is ductus arteriosus and ligamentum arteriosus. Now what is this? Which is a branch of left coronary artery. What is this? What is this? And what is the functional article? Increases the surface area for atria. What is this? Really? What is this called? And this? Arch of aorta. What is this?
Coronary artery.
Huh? Right interventricular artery, branch of which coronary artery? I just said it. I just said a second ago. It's the same thing. Yeah, now if it is not right, then it is left. What is this?
Auricle.
What is the function of auricle? Very good. What is this?
I can't.
Huh? What was this?
Pulmonary. Oh dear.
What is this? Huh? What are these?
Papillary muscles.
What is the function of papillary muscle?
Prevent blood flow. Backwards.
Prevent backflow of blood.
Backwards? Yeah, backflow.
So, if I ask you to follow a drop of blood from right atrium back to the right atrium in this picture, what would you say? Huh? A drop of blood from right atrium back to the right atrium. So how would you say? Can you explain to me? No? From right atrium goes to the tricuspid valve interior. From right ventricle it goes to the pulmonary valve into pulmonary trunk. From pulmonary trunk to pulmonary artery that goes to your lung, and then exchange takes place and comes back. Pulmonary veins into your from left atrium it goes to right aspid valve into your and from left ventricle it goes to the aortic semilunar valve into your aorta, and then exchange takes place and through the vena cava comes back to your very good. And what are these?
Intercalated disc.
Huh? What is the function of intercalated disc?
To make
To
music.
prevent and to allow the muscles to talk to each other. What are these?
EKG.
And what does P represent? URS represents. T represents. What is this?
A heart.
Coronary sign.
Where does it drain to?
To the right atrium.
What about the veins draining to the right atrium? What is this?
What is that though?
And this
Is that inside?
functional capillary muscle.
Red blood valve.
What is this called?
Pulmonary circuit.
Conductive system of the heart. Can you tell me
Conductive system.
what this conductive system of the heart is made up of? What does AV node stand for? Huh? Atrioventricular node. What is the function of atrioventricular node? Atrioventricular node is to delay impulses, number one. And then it checks the integrity of the impulse. And then allows the atrium to contract and then allows the impulse to pass through. All right? What happens if your AV node is not functioning? It is the condition is known as heart block. Very good. And how many types of heart block do we have?
3.
What are those?
Wank you back.
All right, by the time I come back, number one, first degree heart block, draw an EKG of first degree, draw EKG of, wank your back, draw EKG of classical pathway, classical.
Record 'em.
You have a P,
And then long.
prolonged PR interval. Wank your back.
1, 2, 3, missing. QRS.
You have one. Two. Three. So what is missing here? Huh?
Beat.
QRS is missing. After 3 normal beats, 1 abnormal. That is known as wank your back. Then you have classical. This will be your classical. after one normal beat, one abnormal. One normal beat, one abnormal. One normal beat and one abnormal. That is your classic. What is this? Where you
Put
can
the
hear
stethoscope.
your heart sound. What is heart sound? Is how many types of heart sounds we have?
4.
4. 1 and 2 are normal, second and third are abnormal. So how the heart sounds are produced? By closure of the
Valves. Valves. Oh.
by closure of the valve. First heart sound is by closure of the
Aortic.
atrioventricular valve. The second heart sound is produced by the closure of the semilunar valve. What are the abnormal sounds that we have? What is abnormal sound is called? Murmur. This is the capillary. What is called the thoroughfare channel. The other one is called normal capillary bed. How many types of capillaries we have? Continuous capillary, fenestrated capillaries, sinusoidal capillaries. And this is the circle of Willis. This is arch of aorta, brachiocephalic trunk, right subclavian and right common carotid. This is left common carotid, gives rise to external and internal carotid. These are the vertebral arteries which unite and form the basilar artery, and that top part is the circle of Willis. What is this?
Red.
Subclavian artery. This is brachiocephalic trunk. And this is common carotid artery. And this is goes inside your brain. Internal carotid artery. What is this? Huh? The one which goes through the hole in your cervical vertebra. What do you call that branch? Huh? Yes, vertebral artery. This is the one.
I was right.
And becomes basal artery. And what is this part of the brain called? Cerebrum. Posterior cerebral, middle cerebral, and what? Anterior cerebral. Posterior communicating. And what do you call this whole thing? Circle of Willis. What is this? Celiac trunk, which is a branch of abdominal aorta. This is your stomach, this is your liver, this is your gallbladder. So this is the abdominal aorta. Celiac branch gives one branch to your liver, one branch to your stomach, one branch to your spleen, one branch to your pancreas, one branch to your duodenum. All right? So that is your celiac trunk. And what is this? Abdominal aorta. That is your celiac trunk, superior mesenteric, which supplies your small intestine and your cecum, ascending colon, transverse colon. And then this is your inferior mesenteric, which supplies your transverse, part of your transverse colon, descending colon, sigmoid colon, and the rectum. All right? Abdominal aorta becomes common iliac. Common iliac divides into internal and anywhere that you get a trunk that divides. Anywhere you have common, there will be external and what? Internal. Now this is, again, your, which part of your aorta? Abdominal aorta. You have the celiac trunk, you have superior and inferior mesentery, and those are your, goes to your testes and ovaries. What do you call that? Tornado. All right, and this is your supra.
I don't know. How do we know what we need
And
to
these
know?
are your common iliac. This is your right subclavian artery, which is a branch of brachiocephalic trunk, which is a branch of arch of aorta, and this is internal
What's
intercostal
going on?
right internal thoracic artery, and then becomes subclavian, becomes axillary, becomes brachial, radial, ulnar artery. This is your common iliac, internal and external. External become femoral, obliqual, anterior tibial, and posterior tibial, and dorsolateral artery. The different pulses: dorsolateral, tibial, obliqual, femoral, radial, brachial, jugular, and then you have temporal. What is this? The blood cells. This are, what is the function of neutrophil? Phagocytosis. What is the normal value of neutrophil?
60 to 70.
In what condition neutrophil increases? What is this?
Symptoms.
Eosinophil. Eosinophil number normally less than 2%, and its number increases as a result of parasitic infection. What is this? Basophil, less than 1%, and its number increases as a result of
Allergies.
allergies. What are those granules contain? They contain histamine, prostaglandin, and heparin. What is this
Lymphocyte.
lymphocyte? And what is the normal value of lymphocyte? 22, 25% of total white blood cell. And its number increases as a result of viral. How many types of lymphocytes we have? Anybody? What are those? B and T lymphocytes. Very good. What is this?
Monocyte.
Monocytes, when it comes out of the blood cell, is called blood vessel, It's called macrophages. What is the function of macrophages? Phagocytosis. What are these? What is this? Huh? Megakaryocyte. Megakaryocyte and megakaryoblast. And what is this? The lymphatic trunk. Lymphatic duct. Right thoracic duct and
I need chapstick.
left thoracic duct. What is this? A lymph node, the structure of a lymph node. What is present here? What is present here? What cells are present? This is called cortex and medulla. What are these and what are these? What is this area called? The hilum. What is this?
A potato.
it's having two areas, which is red and white pulp. Red pulp, and what is the function of the red pulp? Where the sluggish arteries, old red blood cells and platelets get trapped by the macrophages and get destroyed by those. And what is this? Phagocytosis, adherence, phagosome formation, phagolysosome fusion, destruction, and exocytosis. The process of inflammation. What are the four cardinal signs of inflammation?
Redness,
Redness, swelling, and
swelling,
And heat.
pain and heat. So when the bacteria is released, what are mast cells? Mast cells are specialized connective tissue cells, highly granulated. The granules contain histamine, prostaglandin, and heparin. They are vasodilators, and when they are released, they can cause inflammation. Leukocytosis, margination, diabetes, and chemotaxis.
Is that all?
All right, that's it.